start.
Hello friends, welcome to Dr. Jaggis Academy. In today's lecture, I will teach you about the autonomic nervous system, that is sympathomimetics. In this sympathomimetics, I will restrict myself to the pharmacological actions and uses of beta agonist. So let's start. In this video, I will discuss about the beta receptors, what are their pharmacological actions, what are their therapeutic uses. Okay, I will discuss the pharmacological uses along with the therapeutic uses. Then what are the side effects and what are the contraindications. Then at the end I will summarize the clinical uses of the beta receptor agonist. So first of all, coming down to the beta receptor agonists. So another name of the beta receptor agonist mean the drugs which can activate the beta receptors. Okay, so they are also called as sympathomimetics. Why sympathomimetics? Because they mimic. Okay, they produce the action similar to like that of the sympathetic nervous system and their neurotransmitters, that is adrenaline and noradrenaline. So where the beta receptors are located? So one important type of beta receptor is beta 1, which is located on the heart, and second location is the JG cells. JG cells is the juxtaglomerular cells of the kidney. These are the two important locations of beta 1. Now beta 2, where these are located? In the bronchi, in the smooth muscle of the uterus, okay, in the muscular part of the blood vessels, or in general you can say beta 2 receptors are generally localized on the smooth muscles. Okay, you have to remember the localization of these receptors. Only then you can tell what are their uses, their pharmacological actions and side effects. Third type, beta 3 receptors. They are relatively restricted. Okay, so they are mainly located on the adipose tissues, fatty tissue. So their major role is in the lipolysis, okay, fatty acid liberation. Second location that is identified is the smooth muscle, that is detrusor muscle. This detrusor muscle of the urinary bladder, this has the beta 3 receptors. So I will discuss what are the general actions of these beta receptors. If you activate beta 1 receptors, you will get excitation, stimulation, okay. But if you activate beta 2 receptors, there is an inhibition, there is a relaxation of the muscles. Beta 3 is excitatory as well as inhibitory. Okay, I will discuss all these individually. Coming down to the first of all, name some drugs, the names of the beta 1 receptor agonists. So first of all, I am discussing non-selective beta 1 agonist. And then I will discuss selective beta 1 agonist. In non-selective, we are having adrenaline, noradrenaline, and if you compare the, you can say the selectivity for the beta 1, it is almost parallel. Adrenaline and noradrenaline, they are almost equal. They equally activate the beta 1 receptors. Then we are having the dopamine, and we are having the isoprenaline. So these are non-selective beta 1. That means they can activate beta 1 as well as they can activate other beta receptors also. But if you talk about the dobutamine, it activates mainly the beta 1 only. Okay. So now coming down to the beta 2 receptor agonist. So similarly, we will discuss the non-selective beta 2 agonist, which can activate beta 2 as well as other. Then selective 2. So like previous one, adrenaline, noradrenaline, they are the non-selective, they activate all the beta receptors, but there is an important difference. You see what is the difference? This adrenaline is very selective for beta 2 in comparison to noradrenaline. It means noradrenaline does not activate beta 2 in comparison to adrenaline. Adrenaline is more active for beta 2 in comparison to adrenaline. Then isoprenaline, it activates both beta 1 as well as beta 2. Now selective to beta 2 agonists, which are very useful clinically in the patients. Terbutaline, salbutamol, salmeterol, ritotrine. I will discuss more beta 2 agonists. I have just told some of the beta 2 agonists, selective beta 2 agonists. Then third category of beta 3 agonists, non-selective and then selective. In the non-selective, same noradrenaline, adrenaline. Okay, in this condition, noradrenaline is more active in comparison to adrenaline, inactivating beta 3. In this selective, we are having one drug, mirabegron, which is used clinically. I will discuss the use of this one later on. Now, I will discuss the pharmacological actions, uses of all these agonists separately. So, I am starting first with the beta 1 agonist. Pharmacological actions. Okay. So, let's say you remember the location. Beta 1 receptors are located on the heart. So, beta 1 receptors, they are located on the heart. You give beta 1 agonist, it acts on its receptor, leads to increase in the heart rate, tachycardia, and this concept is called as positive chronotropic effect. It produces the increase in the heart contraction, which is called as positive inotropic effect. It increases the conduction velocity, which is called as positive dromotropic effect. Okay, so it is having the positive effect on all the things on the heart. As a result of these things, where we can use these beta 1 agonists in the clinics, what are the uses, what kind of the uses? Okay, so now very important drug, dobutamine, selective beta 1 agonist. It is used as inotropic agent. Inotropic agent means which can increase the heart contractility. So it increases the heart contractility in heart pump failure. That means when heart pumping capacity is reduced. In that condition, we use the dobutamine. So what are the conditions in which heart pump failure can take place? Like in the myocardial infarction. If you see in the myocardial infarction that pumping capacity is reduced, heart is not pumping, then you can give dobutamine. Heart cardiac surgery, if heart failure happens in the cardiac surgery, then severe congestive heart failure we can use for a short-term management, for a short period of time to improve the contractility. Second drug that we can use is the dopamine. Okay, it is non-selective. It acts on the dopamine receptors, beta receptors, alpha receptors. Okay, but it can be used, and where it is used? It is used in the cardiogenic or septic shock. Very important drug. And it is also used in the acute heart failure. Particularly, it is used to maintain the, you can say, the renal function. That is, I will discuss later on in some other videos what is the use of dopamine in the heart failure or the septic shock, particularly cardiogenic shock, to maintain the renal perfusion. Okay, but it is very commonly used dopamine. So coming down to the other actions of beta 1. First, we have discussed the heart. Second location of beta 1, you remember, it is the kidney. Beta 1 receptors are located on the juxtaglomerular cells of the kidney, like this one. Now these beta 1 agonists or the sympathetic nervous system, it will activate these receptors. What will be the result? Result is the increase in the renin production. It is a hormone. This renin will be produced, it will come in the blood, it will start circulating in the blood, and in the blood, renin will lead to activation of renin-angiotensin system, in which there is production of angiotensin 2 and then aldosterone. They produce increase in the blood pressure, rise in blood pressure, and fluid accumulation. Okay, so this is the thing with the beta 1 receptor agonist. But clinically, we are not using beta 1 agonist for this purpose. We use beta 1 receptor blockers. We will discuss later on. Okay, so this is the pharmacological action. I will not discuss the use because the use is of the blockers, not of the agonist. Coming down to the beta 2 agonist class, pharmacological actions. So the very important location is the bronchi. Beta 2 receptors, they are located on the bronchi. So let's say we are having a condition in which the bronchi is constricted, like in asthma or in the COPD, if this bronchi is constricted, and you give beta 2 agonist exogenously. Okay, let's say you inhale beta 2 receptor agonist, then it leads to the, you can say, you remember, it produces the relaxation, so it produces the, you can say, the bronchodilation, relaxation, and as a result, these beta 2 agonists, they are useful in the asthma or COPD patient. I just want to tell again that beta 2 agonists, they produce inhibitory actions, they produce relaxation, and particularly on the smooth muscles. So I will discuss more use in the asthma. This is the pharmacological action. Coming to use of beta 2 agonists in the asthma. So salbutamol, terbutaline, these two are, when they are used in the asthma, they are having a very quick action. Within 5 minutes, you can say the asthma attack is aborted. But they are having a short duration. Their effect doesn't last for a very long period. So this is the first drug of choice for terminating the acute asthmatic attack. If the asthmatic attack has taken place, if you want to terminate that attack, then these drugs are preferred. What is the mode, the route? They are used as inhalers. Okay, that is the first choice. Now we are having more beta 2 agonists like salmeterol, formoterol, benbuterol. Now all these are, they are slower acting, but they are longer acting. So you can see the difference: quick, slow, short, long. So where these can be used, because they are slower acting, so cannot be, they are not very useful in the acute attack, but they are very useful for the maintenance therapy, so that the asthmatic attack doesn't take place again within that day, you can obviously. So they are used for the maintenance therapy, and particularly if it happens in the night, nocturnal asthma, very effective. So this is the beta 2 agonist in the asthma. So they are also useful in the COPD. Coming down to the other target. So first was the bronchi, second is the blood vessels. So let's say this is the endothelial cells, this is the smooth muscle. So now we are discussing about the beta 2 receptors. I told beta 2 receptors are located in the smooth muscles. So these are located in the smooth muscles. So if you are using beta 2 agonist, it will come and bind to these receptors. Result, I told they are relaxant, they are inhibitory. So the effect is the vasorelaxation, vasodilation. So now, because if the blood vessels are affected, automatically blood pressure will be affected. So what is the effect on the blood pressure? So let's say I am taking the example of isoprenaline, which activates beta 1 as well as beta 2. So now, this produces very interesting effect. It produces the rise in systolic blood pressure. Okay. Why rise in systolic blood pressure? Because this non-selective beta agonist, it activates beta 1 receptors. So if beta 1 receptors are activated, it produces the increase in cardiac output. But at the same time, it produces the fall in diastolic pressure. Why? Because it causes the beta 2 receptor activation, which produces the vasodilation. So remember, the component of systolic blood pressure is from the cardiac output, and the diastolic is from the vasodilation or vasoconstriction. So here vasodilation is there, so decrease in blood pressure. So overall effect is the reduction in the mean arterial blood pressure. So overall blood pressure will decrease. So you can see the effect is variable because there is different receptors are activated. Another target, uterus. As I told, in the uterus, beta 2 receptors are present, and I am talking about the smooth muscle, myometrium. Okay, so I am discussing the myometrium. So activation of beta 2 receptors, particularly I am using a word at the end of pregnancy. It is very important. At the end of pregnancy, what it will lead to? It will produce the inhibition, relaxation. So it will relax the uterus. So as a result, what will happen? The contraction will be inhibited. So What will happen? If you inhibit the contraction, labor will not take place. So we can use this drug, beta agonist, ritodrine, as a tocolytic. What is tocolytic? Which inhibit uterine contraction. So what is the use actually? The use, if there is a premature labor, you do not want to delay the normal labor, but if this labor pain is premature, if you want to that delay, so in labor mean the process in which there is a expulsion of the fetus. Okay, in that process you can delay the premature labor using the ritodrine. On the GIT, gastrointestinal tract, it relaxes the muscles. So as a result, there is a decrease in peristalsis. So you see, this effect is opposite to that of cholinergic drugs. Cholinergic drugs, they increase the peristalsis. So for more effect of cholinergic, you can go to the link which is given in the description section of this video. But in comparison to cholinergic, these effects are less significant clinically. Cholinergic is more important. Sympathetic is less important in the GIT. Urinary bladder. So this is the urinary bladder, and it has a smooth muscle which is made up of detrusor muscle. We are having on the detrusor muscle, we are having beta 2 and beta 3 receptors. So these receptors are there. So if you give beta agonist, either non-selective or beta 2 or beta 3, okay. So it will activate these receptors. What will happen? It will relax this detrusor muscle. If the muscles are relaxed, urine will not be expelled. Decrease in micturition, retention of the urine. So where we can use this effect in the patients, use in relation to urinary system. So there are certain conditions when there is a increase in the urinary urgency and frequency. Person wants to go for the urination again and again. And bedwetting in the children. When the children, they are not able to control the urination during the night in uresis. Okay, so in these conditions, in order to overcome, we can use beta 3 agonist. Okay, to controlling the involuntary micturition. Involuntary means when you are not able to control the micturition, or that condition is called as overactive urinary bladder. When the urinary bladder is hyperactive, urination is taking place automatically, so you can use the beta 3 agonist mirror background. But what are the side effects if you give these kind of the drugs? Urinary retention will take place. It is useful if the person is having an automatic urination, but person with a normal urination, so it will lead to urinary retention. Particularly it is contraindicated when the person feel difficulty in expelling the urination, particularly the prostatic hypertrophic patient, elderly male, in which there is a retention of urine. So these drugs are contraindicated in these kind of patients. Metabolic actions. So if you give beta 2 agonist, they increase the glucose level in the blood. Okay, so glucose levels are increased. Why? I will tell. So that condition is called as hyperglycemia. Why it is increased? Why glucose is increased? Because more of the glycogen is broken down into the glucose. More of the glycogenolysis. Now, why glycogenolysis? Because there is an increase in glucagon. So what I can say is that beta 2 receptors agonists, they increase glucagon, they promote glycogenolysis, they produce the hyperglycemia. So now effect on electrolytes. So if you give beta 2 agonists, they decrease the plasma potassium levels. They enhance the uptake of potassium ions into the muscles. So where this effect can be used if the persons are suffering from this disease, familial, that means the disease runs in the families, genetics is involved, hyperkalemic, more of the potassium is there in the plasma, periodic paralysis, because of more very large amount of potassium is present in the plasma, as a result there is a paralysis. So in this condition, beta 2 agonist can be used because they decrease the potassium levels. So now I will discuss this overall side effects of the beta 2 agonist. Now it depends on the use where we are using. Let's say we are using as an anti-asthmatic agent. because in this condition mostly we are using in the form of inhalers. So as a result, the side effects are very less. But if it is there, what are those? Muscle tremors, they are very common. Why tremors? Because the potassium levels are reduced. Beta 2 agonists, they reduce potassium level, so sometimes very fine tremors are there. They may also produce the tachycardia. Tachycardia, increase in heart rate because of a fall in the blood pressure. Okay, fall in blood pressure produces the reflex increase in tachycardia. So if you use as a tocolytic agents, that means if you use to delay the premature labor, what are the side effects? So they increase the maternal morbidity. That means the mortality rate of the mothers is increased. In the fetus, there is accumulation of the fluid, pulmonary edema, electrolyte and metabolic disturbance in the fetus, a decrease in potassium and increase in glucose in the fetus. So as a result, the use of ritodrine is reduced, is declined. Coming down to the last one, beta 3 agonist. So as I told, their major action is on the fatty tissues. They increase the lipolysis, they increase the release of fatty acids, they relax the urinary bladder. So now I will discuss the summarized uses of the clinical uses. Summarized clinical uses. Number one, they are used in the cardiac uses. That means when there is a reduction in the cardiac heart contractility, we use beta 1 agonist. Bronchial asthma or COPD, we use beta 2 agonist. As a tocolytic, we use beta 2 agonist. In the familial hyperkalemic periodic paralysis, we use beta 2 agonist. Okay. For angiogenesis or bladder hyperactivity, we use beta 2 agonist. So this is what I wanted to discuss with you in relation to the beta agonist. In the upcoming video, I will continue with the beta blockers, their pharmacology, their uses,